Nunavut miublatia ublumi pingahunit illegal to taka nuban nan yuakato Nunavut iloni tamam melukta arveni luti amma hanan naungiti lugo calling ni 10 illegal law me Nunavut iloni takwa taw tamam me arveni law luti ublumi mitikid lugo takwa Nunavut iloni 51 nuban nan yuakato amma takwa katiluk takwa takwa kawi haktaw himayo nuban nan yuakangi mangata 5,190 amma takwa huli malik taw yut 688 nuban nan yuakangi mangata amma 168 Nunavut mute nuban nan yuakakon nertu takwa mamit tu takwa hungilektu okaktalang ito nga kiheno kawak tu takwa Nunavut mute takwa anit tayo koyo yu Nunavut iloni takwa ay himagakaktu nalat chelauta tana nuban nan yuak kiheno kaine akaptigo anna taliti chikuni anakoyaw nginawi ay himakoyaw nalagluta nalalukta aluta takwa ay himaluta anitayli luta kawima yung ayong naktukya amma tahavong alukta ihukakto yang ito tana ay himanang nuban na yuami unatang na kihani takwa maligluit kihani nukay na kaptigo tana nuban na yuwa kawima yung hudwang na ito na ayong naktukya kawayan ito kihani nukaya kakaptigo tana nuban na yuwa ay himakayawit ay himalutit tana nuban na yuwa nukaya kakaptigo Nunavut miyo kihimi nukayu lamang tana nuban na yuwa na takwa malitalaw labut ilabut ihumagilugit nunalakotibo ihumagilugit Nunavut miyo lukta ay humagilugit takwa nalatalaw ta ay himakayawit ay himalutit matna. Good morning. Today, Nunavut has 3 new cases of COVID-19 in Iqaluit. 10 new cases were identified in Iqaluit over the weekend. Nunavut now has a total of 51 active cases of COVID-19. The total number of persons followed to date is 5,190. There are 688 persons currently being followed, and a total of 168 Nunavut mute have recovered from the virus. I won't speak for long, but I do want to reiterate just how important isolation is. If you have been asked to isolate by the public health team, it is necessary for you to do this to protect your community. I know it's hard, and it must be, and you probably feel like it's dragging on, but there is no alternative. If you want to stop COVID-19 in Nunavut, please do it for your family, your friends, and our territory. Boredom and inconvenience is not an excuse. We must all do our part. If you have been asked to isolate, your actions now impact everyone's health. Stay home, be patient, and keep everyone safe. And thank you for Nunavut Mute for being so understanding. Thank you.
Sorry about that. Good morning. This week, through an aid agreement between the federal government and the Red Cross, we will be starting rapid testing in the Winnipeg isolation hubs to add an extra layer of protection to the isolation process. In Winnipeg, the Red Cross will be using the PanBio rapid testing device that can deliver results in as little as 15 minutes. Guests will be tested upon entry into the hub on day 5 and before departure on day 12.
Ula sakkuta bani pena sa ako sa may kayok tao ng mga katigay-gutikot kapamatohak kunik Red Cross kunilo. Pigaktit sinayak tigo kilamiyo ko kawi saktaw gutingin Winnipeg tuyo may veneno to view hatak to ni taman na sapub miyaw kan na kutaw kulog utako anit taili titaw kay nakatatilogin. Winnipeg me Red Cross kut atong na to PanBio kilamiyo ko kawi sa kutiyo unik tako kawi sa kuti utiro na to 15 minutes na to akata. Tuyo may vimitut kawi saktaw hatalang ayut isakata tilugi tuyo may vinupigi abingani amalo ulong atatalimangani amalo awlalalak tilugi ulong ani 12 ngani.
PanBio is an antigen test which looks for virus proteins to identify the virus. A positive test on the PanBio will result in a second swab being sent to the laboratory for confirmatory testing. Anyone who tests positive on the PanBio device will be isolated in their room. If the laboratory test confirms the positive result, the guest will remain in isolation for at least 10 days from when the test was collected. Testing will not shorten isolation. Currently, the testing will be voluntary. Anyone who does not wish to take the test will follow the 14-day isolation period. I strongly encourage people to participate, though, as this will help reduce the risk of bringing COVID-19 to the territory and provide additional protection for our families and communities.
Tana PanBio hauisarutiuyok timimik tamakkunina perukpalliatillugu tamanna hupekko nuvadjoarnartaarutaukunnartoq taadna nalunaartaupat nuvadjoarnartuharningani taanna PanBio tulliani hauisartaukannerajartu aungersivimmi hauisartaugiarluti nalunaartaukannereaqarajangata kinatuinar nalunaartautuaruni nuvadjoarnartuharningani taanna PanBio nerartaujoqauisaruti taakko illuqusimini anittailittaut sautigigialiqqarjartut aungersivimmi nalunaartaulaunginningani taanna tulliani taanna tuyumivimmiittoq anattailikkannereaqarjartu ulluni tannik qauisartaulaortillugu taamannalo qauisartauqattarne qilamiunaart qutaujaangittoq tuyumivimmi taqqikainereaqarninginni maannaujoq qauisartauqattartut angersimaluti kisianiulangajoq kisiani kinatuinna qauisartaugumanngippa taima ulluni 14 anittailituinnereaqarniussajoq kisiani ajorsivuga sangiyumi kikkutuinnai ilauqullugit tamanna ulureanartimi tailititsigutaugunnanga Nunavut Nuvadjoarnaq 19 Nunavummu isirunnarningani qaakkanningagullu sapummijauгутиулуни ilattinnu nunaqqatittinullu.
It is extremely important to follow the rules at the isolation hubs. If isolation is done properly, 14 days of isolation is an effective tool to reduce the risk of transmission. Testing will increase that effectiveness, but as mentioned before, nothing is perfect. Wearing a mask, physical distancing, washing your hands, and staying in your room as much as possible are emphasized at the hubs for this reason. Testing in the isolation hub coincides with the rapid spread of COVID-19 in other parts of Canada. As active case counts in the rest of the country continue to rise, it is important that we add additional measures to reduce the risk to Nunavummiut. Thank you.
Pimmariullarippu taakko amalittauqattareaqarningi tuagautitaujut qallunaani tuyummivinni taakko anittailititaupata taimaa malitsiarlutik taakkoa suurlua tuagai malittaunginnarlutik ulluni 14 anittailini tuyummivinni atuutiqatsiaqqu tamanna searmaqpalliatailequllugu tamanna qauisartauqattarneq ilagiliutiniarmijo ikajoqatauluni kisaani taimaa oqarsimagama kisulimaa taimaa piujullariunginna jaangimmata matoarsimaqattarlutik inuuqatigik qanigiittu aililuaqattarlutik aggasiwaasainnaqattarlugit illuqusitsiinginnaqattarlussilu taakkua taimaima pimmariunerartaavu qallunaani tamanna pijjutigillugu taanna qauisartauqattarne qallunaani tuyummivinni atautsikkuuqutiqartoq taimaa qilamiujukku searmapalliagunnanga Nuvadjoarnaq 19 taimai palliama kanatami taakkua naluneertausimaju Nuvadjoarnartuli kanatau assinginni sulamisongopalliatillugit pimmariuvu qaakkanningagu qanuiliiqutiqareaqarnittinnut ulureanartumiittailikkannequllugi Nunavummiun qoyannami.
Ken Driscoll, EPTN National News. Dr. Patterson, I was wondering if you could update us on the amount of people who have had to go south for treatment due to COVID-19 and their relative condition and anything you could generally tell us about them, like whether their general age or anything like that.
Ken Driscoll, EPTN kuniluta Patterson uqautigunnaqqitigu ullumi moqatsiulermangata Nuvadjoarnartuliin qallunaanu aullartitaugiaqarsimammangaata inuulisartaugiartullutik hanuinninginnu tammalu hanutuinnauqarunnaruvi ukiunginnilluunni.
Thanks. There's nothing I can say. Right now, there's too few people that I can talk about them with any information without automatically identifying them at least to the entire community.
Hoyan na may taka mana yo hausari gunang itaka hatsin na luang at ilulingit hatsin na luang ningino nalo na situin na kakatakik kuningino tayo may mga hausari gunang itaka.
The problem is, like, I know a lot of other jurisdictions have chosen to say, you know, one person's been admitted to hospital or into the intensive care unit. If we provide that level of information, it's very different from saying one person from Toronto versus one person from Aviat. And so for that reason, partly for that reason, we will not talk about those details until there's more than 5 people who've been sent south.
Over 5?
Over 5.
Taman nila akaw ngiliro tiyo masingin na vitos si mavio yuni. Tako sulo unit tumini anna belo mot upalo inuli saktaw no tayo matigi ukaw sa rigukiyat at yung ito tigi gayang asulo tuan tumiyo may ukaw sa kakamataw sa may kaw yung mayawalok sa magayang ito. Kasi nataw sa may ukaw sa kakamak vea mi unitana pidyo tigi lugo kaw yung tsaw tigi gayang nga ilulingin niyo ukaw sa kadyang ito nga tatliman ungatano lang ningin niyo ulit si magyali.
In the past, we've chosen to release information on individuals because it lets people know that COVID-19 is in their community. It helps Nunavut assess their personal risk, and it helps explain the actions we've taken, like deploying the rapid response team. Disclosing that level of information for the people who've been medevaced out of communities that have already been identified doesn't change that risk assessment and doesn't explain any of the actions that we're doing or not doing. So there's no public interest in disclosing confidential information to that level in these cases.
Kingunitin na sakit sa katak sa magalawak tugo tamak kuning ato sa katsaw yunik kita nuvat jo anak ta sa mayunit ako na ninunalin ni tamak ko ulo kaya anak tumigo tao ni ato akada malo tikitit sina gahang na ako tatawang nak tuloy rijini kayo kaya tunik tayo may matay matigi nalunayak sa mayunik nalunayak sa katangit tugot sulo kanga tayo kutawang nak tuko ulak titaw gahang nakat asit jiro tao jangin makano tigi ulo kaya anak tumigo tao ni ngani tayo may matamak ko
Dr. Patterson, last week we talked about you were going to be meeting with municipal enforcement, RCMP, wildlife officers, various groups with the ability to enforce the Public Health Act in Arviat. I'm wondering, since that meeting, has anyone been fined or warned for not following the COVID-19 conditions?
Dr. Patterson, pinasago siyo may ukayuga vikati makatihang na nakasuti. Nunalin ni gawa makuni baila ni kamalo pailisik kunik umayulere inilo. Tako malitaw kay gun nakulog ita makuni nga anahang nang itulere ng mo pero yak tigo ngayonik. Kati malaw tilo si akiliti tao ga hakto kalaw kaubalo niktik tao yung haralaw ka taman na nuwa 19 pilogo.
The concerns that were raised, like on the radio show and other forums, were passed on to the coordinator. Works with the bylaw and other enforcement agencies. I don't know if there's been any warnings issued at this point, because that happened on Friday. Certainly there hasn't been any fines.
Taman na sumalo ti sakit daw law tunalaw ti ko halakat ti sakat tatilugi taman na hausiw gyalaw tutuki mo ti siyemot tamak ko ang baila ko kaya kartaw na alo ti asingin lelo malitaw kay pero yaw yuni kaya mangito tay manganik inaptak taw yo kagalaw mga talem may katimalaw katta ni amalo kaya magalawak tong akiliti taw ga to kalaw ito.
Jackie McKay, CBC News. Dr. Patterson, can you give us more details about the rapid testing in the hub? You mentioned the Red Cross. Will they be doing the testing, and will it be mandatory for everybody staying at the Winnipeg hubs?
Jackie McKay, CBC kunik Luta Patterson ilulingin na house karon nakakilamiyo yung kutamak ko ako yes takatang nelang ng mi kalunan ito yung review unit tako asego bahangit to mi kayo sakta kataraham na ka Winnipeg meet.
The samples will be collected mostly by the Red Cross staff and processed there on site using the PanBio device. And as I mentioned in the update, it's going to be voluntary, at least for now.
Tako kau sakat sa yun no tao katalang ayo tako no Red Cross kanayak tingin no tay kanito yung mivin ni tako pan bayo atong lugit. Kasi ani man now yang si mayoy kasi ani kau sak tao katalang ayo.
In Manitoba, they've had a record amount of hospitalizations. Is there any concern about Nunavut and spaces in Winnipeg hospitals?
Manitoba may ami suna pa ang simalang katatako na belo mo ni si makatakali sumalon nak si bakay no na gumiyo ni kakun nilalang ningin.
I'm not aware of any Nunavut or any health staff being told to divert patients elsewhere at this point. If things continue to rise, it could be a concern, so it is something that Dr. DeVette, the Territorial Chief of Staff, is watching closely.
Kau mang ito sulita ko no na gumiyo balaan na ham nang ito lagi na may kanayak tiyo kau daw lang mga tasuli. Asi ano nga katako yaw lutay na kakun ni nang mud kasi na may song palya tilugi taman na kau yasak palyangin na naktabot. Dahil na daw Dr. DeVette ang iyok kalo tano tamat sa mga kau yasak palyangin na tsakto.
Emma Trent of the Canadian Press. Can you tell us a bit more about how the rapid testing will roll out in the isolation hub? Will people come to their rooms and test them? How is that going to work?
Emma Trent of Canadian Press kun niyo kau tigun nakitigo tako kila miyo yuk ko kau isa ko tiyo ka magiyaw na mga ta ilo ko singin no katalang alvan.
The current plan is for staff to go to people's rooms and test them there, or to collect the samples there and then take the samples to a central room for processing.
Iman na yo pang nasi mayo ilo ko singin no katalo te kau isa ka to katalang ayo tako alo kau isa ko tiya singin ni tatsu mato yung bibiyo asya ni kau isa ka katalo te.
And what's the accuracy of the test?
Kano tam maksima tigi kun nakabalo tam daily kun nakata na kau isa ko tiyo.
It's not as good as the PCR test. That's why there will always be confirmatory testing if it tests positive, and that's why we're trying to do scheduling for 3 tests to be collected over the course of an isolation period.
Tana piyong inaksayo galota ko nga PCR ng nakatayo na kawis ako tiyo katak tunig. Kisa ni tana kawis ako tiyo kawis ko tayo panalo na tayo lunin no vadyo anak to hak tumitay may mat nalo na tayo gaya katam na to asingangin nut amalo tayo may mapingaso akter lutik ta ko kawis ak tayo katalang ayo to yung may biminingin ni.
Dustin Patar, Nunavut News. I know that travel down south is highly discouraged, but if someone from a community such as Arviat wants to go down south for the holidays, how would they go about doing that?
Dustin Patar no na siya kunik tako kalunano aw lahat ako man ang atami suit ay ma tay may kuya ng Iqaluit tilugi kanong likya via mi ni kalunano to ka kumapa kano to siya kakayakan.
Arviat's the only community in the territory that has a restriction on traveling out of it. People who are in Arviat should, if they want to leave the community, need to contact CPHO travel requests, and we're doing that to ensure that we know where people who've been identified as having had contact or diagnosed with COVID-19, that we know where they are.
Avya nito atako awlat tayliga ham na motiki biuga ham na mulo isulit tabihak tutu mata kisani nunalin ni awla ko maguti tat sa mga tutsa rele harisaw yakko tutirak bimo CPHO travel request tako kisani nalo na tayo si mayo kati si yumineo yu to balo wadyo anak to hak tumineo yu kawi may na ko magayakat tigo na may mga ta.
I was wondering if you could give an update as to what the hub capacity looks like for January for people returning back to the territory.
Ukakon nakita ko na nito yung may binikalo na ni January may kanuti tatapalya mga tamako tapalya laktilogin.
It still has some capacity, or at least the last time I looked into it, it did, and I haven't been told that it's reached the limit. But still, as always, we recommend against non-essential travel.
Suli ni kakpala yung galaking ulamit ako na alaw ta kanik suli tamakko tatangit yung galaw kasi ani ilaw kayo nakatakata pimari yung ito ni pidyo ti harlo di awla kata ko yung inata.
Tobi utak CBC kuning tema pinasako siya nung nilo ulumimog tikitlugot ang venito Novak Journal 19 taktuk kanir simalang mata Pinasoroseriattinni qanukkannerniruulluarpita taakkunanga Nuvukjoornaq 19 taartortuni. Over the weekend and up to today, there's been more positive cases of COVID-19 in Alphabet. What should we expect in the next week of these positive cases?
We'll probably see the cases go up and down a little bit as transmission occurs in some households. It's not a guarantee, but it is high risk that you'll get transmission inside these households. The big question is whether or not we're going to see ongoing community transmission, and that's dependent upon the decisions that individuals make. You know, doing things like staying at home, not visiting other people, especially if you've been identified as having the virus or having been exposed to the virus. Those are the decisions that are going to eliminate community transmission.
Tako katsiuningi amisonga palleana mangata katapalleana mangata sulumana yu illumi khatigini sama palle khatanga ni masama piula lagiyangi naluna tawjangi tugalo kisani ulora naqtumi pata illumi khatimini novajwa naqto haqqan tana lenga naqpango yapeqquti yornuna linni sama palleani kayo sinar mangata manna pijjuti kharna suni atuni ismali ruta khattaqtuni inu singin ni surlu ang iqarsimatuin na kuyaw ang iqarsimatu akata ubalupulaga khatangillutik tamakko sa mabiutay ligun na nga tataman na nukhartit sigutaw gunak tumalit siya to akata nunalin ni sa mapalani nukhartit sa kullugo.
Trevor Wright, Nunavut News. What's the plan for a presumptive positive with the introduction of the new testing machine and when it down in the hubs?
Trevor Wright, Nunavut News kun hano pang nasima visita ko pasagiyaw yuning naluna tayo yung nakkan no vadyo anak to hang ningen ni tay kanin Winnipeg mi to yung mivingin ni.
There'll be a second swab collected and sent to another full lab for confirmatory testing, and they'll remain in isolation for 10 days from when the swab was collected, assuming that it's confirmed.
Tana tuliani kawisak tayo kan nakakayak to awlak ti tayo luni asya no kawisak billakin mo naluna tayo garlo ni tamas si mangikalo ang mga maluulo ni huli ni kawisak tayo galaw ti lugan ni tayo kan nakakayak to.
For those who don't already know, what does the recovery process for any one case look like for COVID?
Eko nung ako yung mangito no kano igun niya palay ko ta kasungo bataman na Nova 19 halaw tuminiw tilugi.
Do you mean for how they get cleared for getting out of isolation, or how do they feel? I'm not sure.
When they're confirmed for COVID-19 and they're on their way to recovery? Sure.
Lalo na ito law tilugi no vadyo anak to halaw tilugi kano igun niya nakaktaw katakan.
So most people do reasonably well. They, like more than 80% are able to stay in their own home, or in the case of in the south, isolate in the hotels that are set up for isolation. For when it's happening in Nunavut, we tend to check on them fairly regularly, although it does vary a little bit based on other risk factors and capacity. And when we say 10 days, that's the minimum. On day 9 or day 10, we're in touch with people and checking on their symptoms. The other part of coming off of isolation is they have to be free of fever and other symptoms for at least 24 hours and be doing reasonably well. So there are times where people have had an ongoing cough or a fever. We've kept them in isolation for longer than 10 days. And there are people who, the recommendation for people who have a suppressed immune system or immunocompromise, they need to be in isolation for longer than 10 days. So there's no hard and set rule other than 10 days is the minimum.
Ami suuna se kanu iguti kalo hatangitut 80% ngita ko ang kasimatu ina hatakon naksimayut umbalo kalo na ne to yung mi mil ko sang minito ina luti kisani nuna vummi patatamak ko no vadjo nakta simayut ako kawi ga beo hatak to kala beo hatak sutik pilo akto mi ulo anak to min sa pata umbalo kanayak te khatsa khata uloi khulei te mai ga yotto te ma ulunga ta 9 ngani 10 ngani lota ko khan khawi atak sokta se khatta to khanu iguti khangi kalo mangata ani gum nak se khatta ngata khanu iguti khangi to khata solo utam na khatta ngilutik ulune ila ikakani 24 ni khanu igum ne se mapata kise ani khu so khatta khata utam na khata kuni unak sa uloi khuli ungata no khatta to kisani atole khoy se ma khatta to gota makko timing yam na ma jute khatsa ngi nak sa yakuni nak sani tayle khatta khulluge ullo khuli ngata no
Ken Driscoll, APTN National News. I'm not sure if this is a political question or a medical question, so you guys can sort out who's going to answer. There's no cases in the Kitikmeot, and Yellowknife is a major hub for those communities. I'm wondering, has there been any sort of discussion, lobbying with the GNWT about changing that travel bubble, and what's the status of those discussions?
Entries ko APTN komunidad na government baluan na hanang itula na mukiu ya gumnakto man na yokta ko Yellowknife me novadjo nakto hangin matam balutan na khitir meunot tutar billari uma oha usakar sima visi nuna cha government kungin no taman na take ko awla khatar biu kan ne na mangata.
There haven't been any discussions between my office and my counterpart in the Northwest Territories. I don't know, has there been any? Turn over the rest of the premium.
We've been notified, but there's been no actual discussions. Our travel bubble with the NWT is still there. It's the NWT travels bubble that has, for lack of a better word, burst. So you'd have to ask the NWT officials, but it is on our radar. It is something that we're dealing with. NWT binunit sami Nunavut la waqtut ayung imertu wala huli ki hani iglo nga man ayok man Nunavut mutat nunit sami waqpata apere qalutit pigakang mata antay kanya khatam na pata uplu 14 inutulaw ki hani man ta na nunit sa NWT pekoyari maru maliga qaraptigu ki hani okakati gelo tabun.
And this might be for Dr. Patterson or for the health minister, depending on who has the answer. I'm wondering about the nature of the agreements with the travel hotels as hubs. I'm wondering, is that a rolling agreement? Does it have a set expiry date? Or what's the nature of the agreement with those hotels?
Luta Patterson of Belo Health Minister Tako ang katigi ko to si Mayo Tako to yung bibit akitaw si Mayo Haka isolita benganita nang katigi ko tigi si Mayatsi.
Kuyan na may apiriga bitap sa mga man na isulib tabig sakta kagngito tam nalo isulibig sakta kalagayang nagpat nalo na kayak sutigun kasi ani man na tagbani ublong ni takin nilo kayo ni isulibig sang may pisimang ngitugun. As of right now, we don't have a firm end date. It'll be pretty much on a month by month basis at some point, but right now there is no firm expiry date for the isolation hub contracts that we do have.
Jackie McKay, CBC News. This question is for Dr. Patterson. There's currently some breaking news that the Pfizer vaccine will start being distributed in Canada this month. I know you said that that vaccine is not useful for Nunavut where we need the Moderna vaccine, but are we just going to have to wait till Health Canada approves the Moderna vaccine before people here start getting vaccinated?
Lota Patterson sakki tukataasi mamata ko Pfizer go pigiata ura lengata banita kemika puti o kataloni kanatami. Ukayugalo akutita kaputi mane atukta jangin nakaksigo tayo matuki kakata naipa kaputi Moderna. Ana hamnang itulri yakjua kuno ang ito pakisiani kapuya katakong naksilakita.
That's the most likely way it's going to work. The Pfizer vaccine with the logistical challenges of shipping it at -80, and it has to be maintained at -80 throughout the shipping. It's very impractical for pretty much all remote and isolated communities in Canada.
Teemen ja kuututaan neillä Pfizer kaputi uneraktojo akaunangilo arayangan. Teema nillinakti marealumi -80 mingin nareahanga ullakti tauvalleani timangani tikikaswarningani taana akaunarayangin mapiloaktumi yunga sittugiittuuti nununallinno ullakti tauhattariaharayak akaunarayangimman.
We don't know numbers and timing exactly on either Pfizer or Moderna yet, so it's too early to comment on those specifics.
Hau mangin at ilulingin niya malohangako gayang mga tatako tamakki Pfizer malu Moderna hilamiulo akto kiukaswara nga taana.
For the recovered cases announced today, can you confirm how many of those were in Whale Cove?
Tako kanu igun niya si manirato yo katsiyo mga ta kaun naki katsiyo mga ta kanu igun niya kutakak si mayo Whale Cove tikirak jami.
All of the recovered cases announced today were in Whale Cove.
Ilu natitako na luna kaya kanu igun niya kutakak si mayo tikirak jami ton.
I'm a transfer to the Canadian Press. When we do get a vaccine in Nunavut, can you explain what the plan looks like for rollout? Are there communities you've identified that will get it first?
I'm a transfer Canadian Press nitako kaputi atu na ulakata Nunavut mehano pamnasima visina le nunalisi duliuti taulaka.
Right now, we're looking mostly at higher risk groups that will benefit more from protection. Things like anybody living in like the elders care centers, people over a certain age. Some of it though depends on how much we get in any one shipment. If we're told we're getting enough for 1,000 people, then we'll figure out who would be the 1,000 most in need of protection and work from there.
Mana yo tako piloattomi uloranattumi kunna nersayo sapummayauge aham nersayo piloattomi suulu tako innakkovin miittut ubbalo ukiuli ila ukiokkortu nersait ammalo hanutigi kaputitarne ammangata suulu 1,000 ni pinnerutta tako naluna yakpallealera yaktavukuge ahammangata pigi ahamnerpaat.
When we're doing that work, we'll be following the framework that's been developed by NACI, the National Advisory Committee on Immunizations.
Tako kamagiliruttiku tako malilaartavu parnautilearungussimayo kanatami National what?
Advisory Committee on Immunizations.
Kanatami katimayirala kaputilirinirmu.
And can you provide us with any update on how COVID got into the territory?
Ukausahaw na lakikano Nunavut 19 Nunavut mga.
We don't know for sure. And at this point, I don't know that we will ever know exactly what happened other than the first cases had all passed through the hub. Exactly how and where and when they contracted COVID-19, we don't know.
Kawi mangitugu suli ilulingin ni kawi malaw sa madjavala ingitu wala kisani tako sibulak pango si mayutaw na nakalo na itu yung mivikulaw tu kisani kawi mangitugu kanok nami ang makangako siya mabiw ng mga ta.
Justin Patterson, Natsiak News. So if someone tests positive and it's confirmed, let's say on day one of the rapid response testing when they're in the hub in Winnipeg, can you walk us through, you said it's about 10 days. I imagine they could stay longer if their symptoms persist, or they could wind up leaving and going to the hospital if it gets worse. Can you just elaborate a little bit on what that would look like?
Justin Patterson at sa akong nita ko akaw isaktaw katang na naktilugi Winnipeg mi nalo na yaya ako na uvita ko ulo huli tema ila jau kia kanne kaya ka umbalo ako no inak sa tao na niya kaya kapilo akto me kano iguti kakata umbalo unit to kaya hamne katama na nalo na yakay na.
They'd be checked on frequently by staff working at the isolation hubs. Obviously, they'd be under stricter precautions in terms of isolating in their room. And as you said, if they get too sick to stay at the hub, they'd be sent to one of the local hospitals for assessment and possible admission if needed. And if at the end of 10 days their symptoms have resolved, then they'd be able to travel home.
How is it going na hatta nianga taila ta ko kena yaktingin no to yung may tunod pilo at tumita ko malitaw ya halakit ni maligya halaga yang atail ko singin na ni taili lutik umbalo kanin malwa kata to yung may gun na ilipatahan na bealo mo kay saktaw ya to kayak to unit titaw ya katu na lutilo ni kasi ani ulo huli nung ane kanu ko takangi patatay mangi kamo utak palela ko na kayak to.
But it's important to remember that it's at least 10 days. It needs to be 10 days, and signs and symptoms like fever, cough, those have all gone as well. So for some people, it will be longer than 10 days.
Pimare vota ko ulo huli kanu tigi na mga tasulo kanu iguti kangito akata utang nangito akata huwag sukatangito akata tayo mailangin ako ni unak sa ulo huli ang atano tayo na ikan talaga yakto.
For the patients that have been medevac south, are you able to say if any of them have been put on ventilators?
Tayo ko awlak tayo sa mayo tayo ang nakto ko hanga tayo ko anak sakto timok tayo kakakasima ba.
We're not going to comment on the status of people who've been medevaced out.
O kao sa kadyang ito ko hano iningin ita ko hanga tayo ko tayo ang nakto ko awlak tayo kakakasima yun.
Tobio CBC kunnin tema takkuat qawisaqtuq qortuqaqarnaartut inutuyaqtorpingmi tillugit taana inangersituinnereaqarpat qilammiunersa inutuyaqtorkuvingmiinnermin with rapid testing planning to be used. Will it be used to I'm sorry. Can you let me know if the rapid testing is planning to be used to cut back isolation time in the future?
Sorry, Willie. It's a consideration. We know there's at least some modeling work and some research that's being done to see if you can safely shorten isolation using testing. Right now, though, the priority for us is to reduce the risk of COVID-19 being introduced into Nunavut again, or delay the arrival of it. So if that other testing, if that other research shows benefit and shows that it can be done safely, then we'll consider it at that time.
Taman na isa masasayo tiyo valya yo galo tamak ko to ko tiyo hatta to tamalo kaway sang nikut taman na nailigya tayo ng mga anit tayo tayo hatta ng kallo na ani ta ko nuvad juan na ila taman na pitchu te kallo nga tali taman na nuvad juan na Nunavut mo tikiti tayo tayo khulugo baloking over tayo sa khulugo kasi na kaway sa ko tikut nalo na tayo pat akaw na sa gayam ning niki na ilibalak tayo to na kakayak do anit tayo tayo hatta ning to yung mabini kallo na ani.
Arawa meeting na tuyong mivik Hilton atoktaw vasuri inutuyak torving mut atoktaw pat kanima. Are you still using the Hilton Ottawa Hotel? If so, why?
Yeah, I think we are. At one point there were 3 hotels. There are still 3 hotels being used, at least partly in Ottawa. One of them was strictly a construction hub, and when the volume of construction workers traveling north declined, they started putting some guests over there. So now there's the 3 hubs are being used for general or medical travelers.
Tako pingasu liyong mata pingasu tuyong bibi kallo nani Ilanga atoktaulaus simayugalo illuliortino sanayino qanayiqaartortuno kisani amisno ila khatsinaro pallealenga tatakwa asingaangi teikunga ngaahattalilortuut suulu tamakwa pidjuti khaloaqati aullakhattartut ammalo aannearbeleartui
Ingullerpaataimaa quversivviusaariraarangmat ilinneartikuri qungiartittivakluti angayoqqaaminu ajorunneertamini Tamatomaneo qanuiliurigaavita quversivvingmu qaglilirnittinnu ilinneartoqutittinnu. Christmas is coming up and the schools presents annual concerts for families to show off their little talents. What will this year be rolled out? How will this year be rolled out?
They'd be under the same public limits and gathering sizes that are in the public health orders. And as far as details of what they may or may not be doing for Christmas, it's best to ask either the Department of Education or individual district education authorities.
Mana yote matsain na maligya hangata tamakwa sulu khatsiuga hangi katigod naktut ammalo tamakwa ne hangi tulirina mamalitaw galit ilulengin ni khawigo magutsita ko aperiyo lutan ilinna niliriyikko ammalo nunalin ilinna tuliriyikko katimayingi akaw naksawga yakto.
Kent Driscoll, EPTN National News. Dr. Patterson, it seems most likely that the Moderna vaccine is the one Nunavut will be receiving. Can you walk us through some of the potential side effects of that vaccine and the frequency in which they would occur?
Driscoll EPTN kuniluta Patterson tano Moderna kaputi atoktaulak palay ngalangat lalo na iyagun naki kisuni tamakot kapiyo yung kisuni ipinyaga yung mangata.
Not yet. We haven't seen the monograph and the information that gives all of that data hasn't been released for review yet at this point, or at least I haven't seen it.
What's the monograph?
It's a sheet on each drug or vaccine that gives a lot of the information that Kent's looking for. And I'll let you.
Agasuli. Tako nalo na yakutingi kisuni timi mo atuk tawagutiugun nak mangata suli takulaungin magu. Takwa hanoy tituin na iyagay upalo kaputi timi mo hanoy gutakasungong mangata tukisiga kutingi suli sakilaungin mata.
My understanding from reading what I have been able to access is that the side effects that are reported are some people will get like muscle aches, a very sore, fairly sore site at the injection. But how, what the exact percentage of that is, how likely it is that any individual is going to get side effects, I don't know at this point.
Tukisi mayakko kalimagalagun naksimayang yatuin na yu tamakko kanu gutakatak to kapiyamini yu sulu kapiyami biningane na jumagalo katak to kisani kanu 30% tingi kayo mangitak tamakko kanu timi minut kanu gutakta katalaw mga tao tokak tao tilogo.
And Ulipika, thank you for that question. I didn't know what a monograph was either. My next question for the Premier, please. Premier Savikataaq, one of the things you've warned people about throughout the COVID-19 response is about spreading unfounded rumors. Now, you don't have to look very far on Facebook and Nunavut right now to hear a lot of talk about the vaccines in general. My question for you is, when the vaccine becomes available to Nunavut, will you be taking it at your earliest opportunity?
Savikataaq sivulati ukhawasakhatak simagavita ko akikutuin na inovadyo na 19 sulingit to ne ukhakhata ko nagipilo aktami mana yu Facebook kuno na bumita ko na khatta nga tamat suma kaputi mitsanot ilinul lekhano tana atuin na ulek kaputi kapiyaw saut kapikayaw khataw saut gilaki.
Yes, I will be taking it when it's appropriate for me to take it. Well, I'll be standing in queue with everyone else that'll be taking it. I won't be jumping the queue, but when it's my turn, I'm allowed to take it, I will take the vaccine. Ita na kaputi anya kam nangito nuban na yami nunavut mi dak patak pakataw yung makto ki henteng hibunenu lang ito takwa ayung itu kapiyaw na lakpat tay kani tay kini kataw yumak kapiyaw yumak tana tamani atwin no lakpat.
Jackie McKay, CBC News. My question's for Dr. Patterson. How is enforcement and fines for breaching public health orders being handled for people who are breaching the orders that are underage?
Jackie McKay, CBC, Kuniluta, Patterson, Tako, Hano, Malito, Gali, Malito, Korto, Hatak, Malakiliti, Hatak, Hatamakunana, Hanangitulana, Malito, Gali, Nesahumito, you have to minute to go. Okay,
That would be a better question for justice. They'd be the ones who have the knowledge of the ins and outs of enforcing these orders for minors.
Taman napasok tayo siya kung nanaksa maligalik riyik no maligalik rin mo nga mata ko ilulingin ni tay ko ako yung manaksaw gayang tatamak ko nung kiukitun.
Is there still problems with community transmission happening in Arviat? And can you update us on how the Red Cross team is doing there?
Sula ka nguli ko takakar vean inunalin na ito sa mapalianing inutambalo Red Cross kusulitaw wani pakisulirit shooting.
The Red Cross team, I believe, left yesterday. As far as community transmission, I'm not aware of any evidence of community transmission over the weekend. So we'd have to go back to sometime last week since there was clear signs of that, but it's too soon to say that it's not happening.
Eko Red Cross ko lak pala yung miniipat sa ulak to. Kasi nalitaman na nunalin ni sa mapala mga sulikaw yung mailakaw yung lang ito nga pinasawa ko siya nung wani sa mapala yung kalaw mga nunalin ni. Kasi pinasawa ko siya lang ito may inalaw na lang ito suli nunalin na siya mapala lang ito kasi man nakilami ulak ito o kakasawa ko.
I'll do a job. Thank you.